their assessments, give their medications, monitor their treatments, notify the doctor of any pertinent changes, send them to the hospital if we need to. We do have to do that on occasion, and lots of education.
And they're there for about 3 to 4 hours each time they come?
They are, as a general rule, a treatment will be 3 to 4 hours, and they come 3 times a week.
And you're a patient care technician?
Yes.
So what do you do with the patients?
Assist the nurse with the patient care. We come in the morning, we set up all the dialysis machines before the patient gets on the machine.
Turn it up.
We also monitor during the treatment. We get their pre- and post-vital signs. We weigh them when they come in. We put them on the machines. We take them off. And like when we're monitoring them on the machines, we let Joy, our nurse, know that the patients are having any problems or any complications.
What's a typical day like for a patient? Someone at home may be saying, you know, my doctor said I needed dialysis. What can they expect?
As a general rule, depending on which clinic they're at, that will drive what time they need to come to their treatment. But they would come to their treatment. We ask them to be there about 15 minutes early. They wait in the waiting room until they're called, and then come back away. They'll go to their station. We'll get their vital signs, get them hooked up to the dialysis machine, and then there's a television they can watch, or they can bring a computer or radio if they want to listen to that. Some sleep, some visit with their neighbor. We take their vital signs every half hour, more frequently.
She's hot.
And how are they hooked up to the machine?
They will either have a catheter, which exits their body, that we hook up to, or they have what's referred to as a vascular access, that 2 needles are placed in, one to remove the blood, one to return the blood, much like if you were doing pheresis, if anyone's ever done pheresis. And we remove the blood, it circulates through the machine, takes out the toxins, just as a kidney would, removes extra fluid, and then returns that clean, decreased fluid blood to the body. When that's over, we remove those needles, make sure they're not bleeding, and then they're free to go about their day.
And we should mention this very quickly. We probably have about 20 seconds left, but you can do this at home or in the clinic. At home, do you have to have assistance from a nurse or someone?
Well, we have home hemo. Those patients there need a partner. And we also have the peritoneal dialysis. But if you're going to do home hemo, they would like you to have a partner to assist you in your care.
Okay, how can people get more information?
They can go to DaVita.com. That's the website for DaVita. It's got 800 numbers and a wealth of education.
You can also go to kidneysmart.org as well, and it's 1-888-MY-KIDNEY. So if you have any questions, maybe you're considering or a loved one is, go ahead and give them a call. Thank you, ladies. Good information.
Thank you so much for having us.
Stay tuned. More Talk of Alabama's coming your way. Up next, we have
She did great.
a documentary.
She did, but I don't understand why she did the majority of